I will speak about how Fiocruz is facing this challenge of climate change. Of course, Fiocruz is an institution that belongs to the health ministry, and one of the main goals and commitments is support the health ministry and the Brazilian government. So what Agnes said is one of the main references for our action. And on the other hand, we have a very distinct setup in terms of an institution, because we are at the same time an institution that has a lot of production of research and also a wide scope of activities coming from not only health surveillance, but health production of vaccines and drugs. We have schools of public health, hospitals, and so forth. And so this gives us a possibility of having synergies between different aspects of acting in the health area. And another aspect of Fiocruz, which is important, is that we are a national institution, not only because we belong to the health ministry, because we are present in 11 states in Brazil. And we act in all the regions with the different realities. And so we have this commitment also, as part of our history, to think in terms of how we conceive developing in Brazil the problem of nation building, state building, and so forth. One thing that, one thing that we always stress is that when we are thinking of climate change, we have to connect with the planetary crisis as a whole. It's not possible to think of this as a separated, insulated area, and we will stress this fact. We are talking about the various multilateral agreements addressing planetary crisis. This is just to mention three of the most relevant ones: the 2030 Agenda, the Paris Agreement and its Sendai framework, but of course there is biodiversity. And all these have their specific tracks. But we think that in a way, the 2030 Agenda is the one who has the most comprehensive way of connecting all the questions related to economic, social, and environmental in an articulated way, and also that has some aspirational values related to planet, people, prosperity, peace, and so forth, which are translated into the SDGs, naming the main challenge that we have in terms of, after all, what are the effects and the consequences of this planetary crisis in question related to poverty, the question of food security, the question of violence, the question of gender, and so forth. So we think that we should always be very attentive in connecting climate change, the Paris Agreement, with the 2030 Agenda. And this is, let me see, okay. This is, I just mentioned this article by the three presidents of Brazil, South Africa, and Spain, because, of course, all this is very much connected in terms of one of the main focus of the 2030 Agenda also, which is partnerships, multilateralism, which is facing a heavy burden nowadays. And again, they refer to these main forward, the G20, the COP30, and so forth, but always mentioning the importance of the 2030 Agenda with the Paris Agreement and thinking about sustainable development. So in a way, even when we are thinking in terms of how the COP mandate, for instance, for pragmatic and very important reasons. Is stressing the question of implementation, what is decided, the question of financing, which are the main questions. We always think, in terms of how the climate change should be connected with the idea of sustainable development as a whole, because the determinations of all these crises sprung from the same root, which is the unequal model of development, and the way, it's shared, and the question of how this produces inequity, and especially with the most vulnerable populations. This has been, as you know, we're talking about with people who are very much aware of all these questions I'm addressing. This has been one of the things that the UN, through the UN Secretary General, has been stressing. And this phrase, which is from 23, but it's a very important statement. It is becoming increasingly unhelpful to discuss development plans and climate policies separately. The 2030 Agenda and its Sustainable Development Goals must be at the center of all policies and plans to combat climate change. The connection between the two agendas is imperative, the Paris Agreement and the 2030 Agenda. This is not only a rhetorical statement, because there are a lot of work trying to show how important it is to have the synergies between these two areas. There is a UN report from last year that it's the UN synthesis report showing how you could face these co-benefits between addressing together these two agendas. And this has an important consequence in terms of finding technologies would be sustainable and would have a broader impact on questions related both the SDGs and the questions related to adaptation and mitigation of the climate change. But the reality is very challenging. It says here that only 23 out of 173 nationally determined contributions submitted to the UN Climate Convention explicitly refer to the SDGs, and none provide details on how climate policies impact the implementation of the 2030 Agenda. So this is a challenge that we have to face, and Fiocruz established in 2017 what we call the Fiocruz Strategy for 2030 Agenda. So this is one of the main references for institutional development, for connecting our programs, or connecting the networks we work with. I will not need to go into details in terms of, for you to remind the relevance of climate change and its connection to health. There are important statements from that's quoted here from Tedros, saying that the climate change is the greatest global threat to human health, and the Paris Agreement is potentially the most impactful health agreement of the 21st century. And we've been following the evolution of how the health has been trying to have more presence and protagonism in COPs, in the Paris Agreement, and the question of climate change. It has been important, I would say, recognition of this, but we know that this is a very hard and faced with a lot of barriers goal. It goes in ups and downs. Sometimes, as we have in Dubai, a healthy day, we think that in Baku, although there were important questions related to equity, the ministerial declaration of climate change, health, and equity, and there is always this idea that health is the argument, important argument for climate change and also it's a very important way of bringing the awareness of the emergency of climate crisis. But we know that at the end, there is we have to really try hard to have some questions related to health included in the formal declarations of and decisions of COPs. So this is an open question. There are historical roots that show that there is this idea of silos. There is different communities, different priorities that were connected to these different multilateral agreements. But this is a real challenge. And Fiocruz, of course, and the health ministry and the World Health Community is trying to move forward in this direction. I want to go into much details because of the time, but since we started in 1900, this question of health and development has been one of the main questions faced by Fiocruz in its original matrix and the development throughout these 125 years. We have important references from the health area, such as the social and environmental determinants of health, which is very much connected with the principles of 2030 agenda. And we have also now what we call a Fiocruz strategy for climate and health. We decided that besides this connection between the 2030 agenda, it would be very important to have a specific program to prioritize this connection of climate and health. And we approved by our board of directors, and now we are having a working plan that is ongoing. And these are the priority areas, which of course are coincidental with the priorities of the health ministry, to generate and disseminate knowledge, especially the question of related to health equity and to vulnerable populations, strengthen the resilience of SUS, and also to think of the health economic industrial complex directing its effort to climate mitigation and also climate adaptation. When we think the health industrial complex, as you know, in Brazil is around 10% of the national income growth. And this is also one of the average for the developed countries. So if we are able to use the convening power and the induction power of the health the ministry, and especially in Brazil, when we have a unified health system, we could move all the chains, for instance, of production, in the case of vaccine, drugs, and so forth, hospitals, the personnel that we involve in the health field in terms of the capillarity we have in terms of coming to the population, and having this in a way that they would be committed to climate mitigation and adaptation. So the other one is, of course, prepare for response to climate events, extreme climate events. We have a very strong experience of acting at a territorial level. We have this institution program I recall Sustainable and Healthy Territories. This is something that we've been developing for decades. And now there are ever increasing experience in which these communities and territories are being organized in terms of facing climate change. And one of the things that we have, for instance, is adding to this a development which in Brazil is very strong, of what we call the health vigilance, popular health vigilance, which is that the communities will identify in the reality in the territories, which are the main threats, the main challenges, also which are the resources they have, which are the barriers to face the question of health vigilance and health, but also addressing this to climate change. I won't be able to quote, but we have many, many very interesting experiences in areas in the periphery, slums, and so forth. And also, we think it's very important to promote social technologies. Usually we think of hard technology, but it's important to connect hard technologies with social technologies, and we are doing this from many ways, such as the social cartography that is done with the connection between images of the earth, with the way people understand their territory and decide which are the ways of making a cartography that involves social demands, cultural realities, and so forth. And one important reference that is a One Health approach. I'll try to move faster because of my time. Fiocruz has a strong experience. I just highlighted here some of the main structural areas that we have. We have a Climate and Health Observatory. We have the Center for Data and Knowledge Integration for Health. This center is doing a fantastic work led by Mauricio Barreto. They have, for instance, a program with the funding from Welcome, in which they have one of the most important data that we have in Brazil that comes from the data from the social programs, and they are doing this connected with climate change, the impact of climate change. And one of the questions they are developing, and this together also with other international centers, such as the London School of Hygiene and Public Health, is the question of attribution of how we really are able to show the effects of climate change in specific health consequences. I already mentioned the Institutional Program for Health and Sustainable Territories, and we also are part in the coordination of National Institutes of Science and Technology on One Health and in emergencies. For the things that we're moving ahead, I just brought two examples, which I think are important. One is we are building a synthesis center on biodiversity, pollution, and health. You probably are aware of synthesis centers. The idea is the challenge to connect complex areas and work with the science of complexity, science of trying to connect the sense of different aspects of facing and trying to understand reality and intervene. And we didn't have up to now, we still didn't have any synthesis center on the health area. So we are moving in this way. And we decided to have these two important connections of biodiversity and pollution. I won't go into details of the objects, but they are pretty obvious in terms of analyzing, in terms of contributing to translational for policies and so forth. And the other one is this is a very cherished priority program for the Fiocruz presidency, is setting up the Rondônia Climate and Health Center. Rondônia, you probably know, is one of the states of the Amazon. It has a very, very important challenge in terms of sustainability, in terms of the connection with inequities, and we have a unit already in Rondônia, but we are together with the many different institutions The University of São Paulo is one of the institutions that's one of our big partners, but we are doing this together with also local population representations, the areas of the universal health system, and so forth. And the idea is to have a national center, but of course, with a focus also in the reality of the Amazon region. Again, the important things of knowledge generation, extension, dissemination, the action at the territorial level, One Health again, and all the things that are connected with the Fiocruz strategy and also the health ministry strategy. Actually, this initiative is part of the working plan for the sectorial adaptation of the climate plan in Brazil. Well, I just end up with my presentation with this statement from our president, Mário Moreira. Fiocruz holds a unique position and has been called upon the global effort to prepare for new health emergencies where climate is a decisive factor. It has taken on responsibility and centrality, and it must be prepared beyond its traditional role in research, education, and scientific production with a strong coordination effort. So the Fiocruz strategy for climate and health represents this coordinated action, not only within Fiocruz, but also in collaboration with other science and technology institutions, Brazilian health authorities, and international cooperation efforts on an issue that is already deeply embedded in the institution's tradition. I want to go further because of my time, but just say that we are very much in depth in terms of the preparing ourselves to contribute to COP30, and in different instances, of course, in terms of the official position of the Brazilian government, but also in terms of the green zone and the connection with social movements. We have very different initiatives that we are organizing, but of course, you know, also the difficulties we still have in terms of logistics and so forth. So thank you very much for inviting me here. I think this is a very special forum. I've met, I think, few of you in the Brazilian meeting, and I hope that we may also, with the forecasting health futures, establish a bilateral cooperation. Actually, the question of the forecasting or other ways of thinking of the scenarios for the future is a very important part of Fiocruz activity. And now, as you know, the Brazilian government is so developing what we call the 2050 plan. That should be one of the main guidelines for establishing the pluriannual plans that Brazil has for each 4 years of presidential mandates. And climate change is an integral part of this idea how the future will be. Thank you very much.